Hello, this is chapter 11, and I realized for the week two, there's only I have only one video of all my five videos, but still I'm keep making this. I'm not sure how it can help, but since I promised to make this, continue to make this. And so this is chapter 11, the digestive system, and the first word is oh oh colado. Coladocus. Coladocus. I haven't here. Let me try to fix it. Coladocus. Um, col colo means bile, and you may heard another word called cholesterol. Cholesterol. You must heard this word. Cholesterol means bile sterol. Steroid. The steroid from the bile. That's the cholesterol. And the cololactis. Colactus. Duct. Duct means duct. Bio. Bio duct. And honestly, to the best of my knowledge, even in the most serious academic papers or documents, you can still use bioduct. I don't think a lot of people use the coloductus nowadays. And however, it's still meaningful. I mean, still useful in this word because there are other words still using the colon, whatever. Now, for example, cholestasis. Titus means inflammation. Cyst means the cyst or the sac. Bile. So bile sac. What is bile sac? Gallbladder. Gallbladder. So and cyst titus inflammation. So gallbladder inflammation. What can cause gallbladder inflammation? In many cases, it's caused by gallstone. Gallstone and kidney stone, I think that's the most common stone in our body. And see, gallstone. So, and then the next word, not next word, next word, colon lymphatic acid. Means the gallstone, but actually it's not really gallstone. Colon life is gallstone. Assets means the status, having gallstone. And see, let's continue and talk about the other word, the cholecystokinin later, because that's different than all the others. And then keep going. Holodalcho leptotomy. Ultimately, we have been talking about the opening something. Holodactyl, the bile duct, little stone. So this means gallstone removal with a surgical approach. And then the next one is colodactyl lithotripsy. Means this is a non-surgical approach to remove the gallstone by, for example, ultrasound, make it smaller, so it can go all the way through the bile duct into the small intestine. And last word in this page, holodactyl, not colodactyl. Cholecystectomy. Cholecyst. I mean, we mentioned that means the bile sac, which means the gallbladder. Ectomy, remove. remove the gallbladder. Why you need to remove the gallbladder? Gallstone. So all of those about the gallstone. Next one. Look at your page. All right. And now let's coming back to this where we have skipped. So cholecystocinin. This is a hormone, and it's more widely known as the CCK. What kind of a hormone it is? This is hormone is let me see. I try to draw. This is the stomach, and then small intestine, duodenum, ileum, ileum, and then large intestine. Up here, the large intestine. Okay, and use a red color. This is the liver. A liver inject the bile duct into the this is the pancreas. Pancreas. Liver. And so then here, and they fuse together all the way into the duodenum. And so this CCK, cholecystocinin, is produced by this part, the duodenum. The duodenum produces CCK. And then what's the function of CCK? The CCK function go back, tell the liver to produce the bile, to release the bile into the duodenum, and then tell the pancreas to release the pancreatic juice into the duodenum. And and what kind of things can trigger the CCK production? The food. When the food coming in to the duodenum, it trigger the CCK to produce and then promote more stuff getting to the duodenum to help the digestion. Okay, I would like to save this figure for later, but it doesn't look that nice. But anyway, so keep going. Dyspepsia. Dyspepsia. Dys means say difficult not good. Anyway, pepsia, digestion. Myofunctional digestion, or we call it indigestion. And pepsia, and you may have heard of a PepsiCo. And why I call this name? That's at the very beginning. Pepsi is sold in the drugstore as something to help your digestion, and Pepsi itself in its digestion. And not bready Pepsi. Bready Pepsi is not really used a lot. Bready Pepsi is slow digestion, and then in a medical term, what is more often used as is not a bready Pepsia, but rather gastroparesis. Gastro means stomach. Paresis is paralysis. I mean slow down of the stomach. That is slow digestion. And next, this is Dysphagia. Dysphagia means it's difficult in phagia means eat. Here in this case is swallow. Right? Swallow. So in difficulty in swallowing, it's maybe a very serious condition. And many people got this because of say stroke or some the central nervous system problem. And aphasia, which is a very serious condition of dysphagia, means unable to swallow at all. And then keep going. Next. Polyphagia. Polyphagia is less commonly used as it's the same as hyperphagia. And I think hyperphagia is more used, means eat a lot. And medically, it's often related to something related to that, some other metabolic conditions such as diabetes. In the case of diabetes, diabetes means this is a condition that glucose stay in the blood vessel, and it's not really an overall accumulation of the glucose in the body because glucose only stay in the blood vessel. But the other part of the body actually do not have enough glucose supply because you cannot move the glucose outside the blood vessel. And then one particular part, the brain, does not have enough glucose, and then the brain keeps the body eat a lot. That's why diabetes patients often have the symptoms of hyperphagia. And let's see. I next one. Anorexia. Anorexia, that's this low appetite. Anorexia, whatever. This is low appetite. Doesn't want to eat. And it's also a medical condition. Some people do fasting, reduce their food intake for a long time, may eventually result in anorexia. I think it can happen in some kind of models or other occupations that need to keep your body shape. And postprandial means after meal. It's used a lot in the medical term. So postprandial means after meal. It often refers to postprandial glucose blood glucose level. And next one, diverticulosis. Diverticulosis. Say this is small intestine, say in the body, or a large intestine in the body. So either way, in some places, if the wall becomes thin, there's maybe a small bump getting out the original places, and this is called diverticulosis. And in many cases, this does not really affect much of those as long as all the spaces. But in some cases, it becomes leakage, and you can remove it. Now you can remove. You need to remove it. Keep going. Gingivitis. Gingivitis is a gum inflammation, and if gingivitis is not treated in time, it it can further, say, develop into a more severe gum inflammation. And this is what we have learned before. This is called pyorrhea. And I think pyorrhea is less commonly used than the other word called periodontitis. Periodontitis. Oh, periodontitis. Yes, periodontitis. I think this word is more frequently used. Periodontitis is the inflammation surrounding the teeth. And a similar word, orthodontist. That's the doctor who gives you the braces of the teeth, orthodontist, and to help align your teeth to have a better bite. And keep going. Hepatitis. We have this word before, hepatitis. And hepatitis means the inflammation, the liver inflammation, which may be caused by virus, in many cases by virus, or metabolic. So that's two major reasons. And gastritis. We have also mentioned this in the chapter 3, and it's largely because the lack of mucus on the surface of the stomach, and the stomach cells are damaged directly by the acid in the stomach. And gastroenteritis. This is inflammation in the stomach and its intestine. What kind of inflammation can have this kind of overall widespread inflammation? In many cases caused by infection, and this also called stomach flu. So this is not overall umbrella word to include everything here, but this is more specific specific meaning, whatever, refers to the stomach flu that caused by infection. And next, appendectomy and appendicitis, inflammation of the appendix. So try to draw the trying to draw. Okay, this is the large intestine, and this is the appendix, and here this small intestine. And this is joint of small intestine, large intestine, and this appendix. And the one appendix have inflammation. If you have something blocked here, and nothing get out and get in, some of the bacteria overpopulate inside the appendix, causing inflammation of the appendix. In some cases, it can be treated by medicine, but in a the inflammation called appendicitis, and sometimes it can be caused by inflammation. It can be treated by medicine, but in some very severe cases, it can only be treated by cutting it off. And what's the word by cutting it off? This is the word. Appendectomy. Appendectomy means cut the appendix off. And it makes me be very accurate, because if a lot of inflammation going on and on, and the bacterial leakage outside of the appendix, it may cause even serious problem of the lung. So in that case, you have to really remove the appendix. Let's see if there's something. Okay, whatever. Pancreatitis. Pancreatitis. With the pancreatitis, it's all so pancreas produce a lot of the enzyme here, and but this enzyme and this enzyme is supposed to be delivered all the way into the duodenum. However, if the enzyme become, in most cases, this enzyme is supposed to be in the inactive form in the pancreas. However, in some cases, if the enzyme becomes active in the pancreas, causing pancreatitis, so it's very painful. And why it can become active? There are many different ways. One of the things is that this pancreatic duct is blocked, and eventually, if it becomes really bad, the one way to treat it is to remove the pancreas. Can be very serious. And let's move back to the colon. Colonoscopy insert a camera all the way to view the whole colon. We have already mentioned this in chapter 1. And enterography. Right. Enterography, it means suture. Graphy means suture, and suture the entrails. And in some cases, it's maybe even when you have to open up the enteral means the intestine. And for example, you remove the some of those hernia. We'll talk about hernia later. Whatever. So any of those surgeries, you open up the intestine, suture back, call it enterography. And helography. Suture again. So what kind of thing is the suture? Kilo means lip, and that's mainly happen. I'm trying to draw a picture of the eye, and the lips, the lower lips is normal. However, the upper lip has a gap between the two left and right side, and it doesn't fuse together. And helography, in most cases, the suture this back, upper lip back, and it's a developmental issue of this one. The fistulectomy. Lectomy, remove something. What is what kind of thing to remove? It's a fistula. Fistula. What is fistula? Coming back here. This is the anus. And in human, there's only one anus, right? But in some cases, there's for some reason, there's a small tube and open up in the body, and the stool keep leaking out from this hole, and this is called the fistula. And fistula means any of those tubes connect two organs together, And in the case of a fistulectomy, in most cases, they remove this actual tube connected to the lower rectum and the surface of the skin. Remove it. Sublingual is under the tongue. In most cases, sublingual refers to the sublingual salivary gland. The one pair of big, relatively big gland under the skin. Some people even develop this capability. They can squeeze this saliva out again. You can search for the videos. And siloid, a stone in a salivary. I'm not sure how often it is. But next one, glosectomy. Glosectomy, ectomy, remove something. What is removed? Glos means the tongue. Removing the tongue. Why you have to remove the tongue? Mostly because of cancer. Then the smoking can cause tongue cancer, and then eating something really too much fiber also increase the chance. And colectomy, again, remove something. And this time, what kind of thing you remove? Colon, part of the colon. Right, we have to remove part of the colon. Cancer, inflammatory bowel disease, IBD, inflammatory bowel disease, and this is a continue going on inflammation in the lower bowel region, and for other reasons, you have to remove part of the colon. And then the doctor to do those call it proctologist. There's a surgeon to remove the colon. And proctoscopy. Proctoscopy is only checking the lower part of the rectum, anus rectum. This is a relatively easier, just using a light can do this. It's not as deep as the colonoscopy. And another thing called it sigmoidoscopy. What is sigmoidoscopy? Hold on. There are different sections of the colon. Okay, this call it ascending, this call it transverse, this call it descending, and this the part, this call it the part that is diagonal back to in the center. This call it sigmoid colon, and this is rectum. In some cases, if you're not looking for screening for the cancer in the whole colon, and in some cases, like say people see blood in the stool, you only need to look into the sigmoid. The sigmoid scopy is looking only into the sigmoid. In some cases, I think you don't really need a general anesthesia for the sigmoid, sigmoidoscopy. Although you need general anesthesia for the colonoscopy. And last, hernial raphe suture. What is suture? You need to remove the hernia. You remove the what is hernia? enlarged part of the intestine penetrate through the membrane into outside the abdominal cavity. It's hernia. You remove the hernia and suture back. And bulimia. I mean, I'm not sure. This is my first time heard of this thing. Bulimia means eat a lot at the beginning, and then because of the weight loss, and after eating a lot, vomiting. I mean, I don't know whether nowadays people still practice, but the story in the ancient Rome people to eat a lot of things, and after each of the meal, I mean, they have several courses of the meal. After each course, they use a feather to get into to their throat, and then vomiting everything out, and then they go to the next meal. I'm not sure this is related to that behavior or practice, bulimia, whatever. Okay, that's it for the chapter 11, the digestive system. And thank you for watching, if you're watching. Okay.